moving to K to 12 education, I got a question from a constituent that says, students are under a lot of stress due to the pandemic and remote learning. What can we do to help improve their mental health?
I think that, if you don't mind me going, I think that we have a responsibility to be providing supports to homes. The mental health stuff primarily starts with the family helping with that and the schools being a support. And, having fully funded schools, having full service schools where we have mental health supports in the schools ready to go is something that we just aren't taking seriously. In Mounds View, we're acutely aware of this, and we need to be much more conscientious about providing the kind of resources they need. The facts are that we have neglected several parts of our education system over the past 10 to 20 years that need to be addressed, and we have to make a decision as a state what our priorities are. And for me, I can't imagine a greater priority other than of course, our health and wellness, well-being, of course, as a state, than the health and well-being of our children in our schools. And so the fact that we've used K-12 over the last 10 to 20 years to be a political weapon rather than just being a priority for us across the board and bipartisan is kind of lost on me. I don't understand why this has to be that difficult. So my goal is to make sure that we're providing those supports to students, not only when the pandemic ends, but as soon as possible. We have to be providing, and it isn't just the students, it's got to be to the families, because the families are where we have a lot of this going on, and we need to make sure that the parents are empowered with what they need to meet the needs of their children, and that the schools can identify when that's not able to happen or a student is in a bad place, and this pandemic is causing a ton of isolation. The research is pretty clear about that, and it's really an unfortunate reality that what we're seeing, especially in the areas of mental health, is that the inequities that were already there that people could ignore, they can no longer ignore. They're now wide open and a huge red button for everybody to see. And it is going to be our responsibility to fix that. Well, I was in our first K-12 meeting with Senator Chamberlain, and I'm a little skeptical, but I was heartened by their approach and what they talked about, that they saw this reality as well, and that we're going to hopefully have a bipartisan solution if they're good to their word. And I told them I am committed to working with them 100% to getting across that finish line. This isn't a Democrat win or a Republican win. This is taking care of our kids, and it's got to be one of our top priorities in this session, is making sure that we make our kids whole. And I want to just give you a little example. When my kid was in kindergarten last year, we went to distance learning in like February or March, right? When all the students came back and he was in first grade, all the students in his class were all at least a half or a full grade behind in reading already because they missed some crucial reading moments. That's just in the educational piece, right? We saw that behind. What we don't measure easily, because we're not grading it, is what kind of experiences they're having being at home when they're not able to be at school, to have the socialization they need, to have the learning experience they need. Some of these kids having their square meals happening there because they may not get them at home, the kind of supports they're getting at schools, what's missing there, and what are we going to see with these folks when they come back in the next 6 months? And that's something we need to be very, very mindful of. And I'll tell you, that's one of my biggest focus. When we went to that meeting and heard a ton of testimony about the kind of devastating effects we see happening, while we had to do what we had to do during the pandemic, we now have to take responsibility for helping that, because these kids didn't ask for that, and that's our job. That's our responsibility. So for me, it falls on us 100% to get in front of this, to figure out and accurately assess what's wrong, and to provide the support. And I think the number one first thing we're going to have to do is provide help on the psychological aspect with counselors and folks that can help families put this back together when it's over. So I'm super committed, very aware of it, and I will be following through on that as much as I possibly can from my seat here in Shoreview. Thanks.